We've got our final panel discussion of the day, and this is something which has been a theme, which has been like a thread throughout the conference so far, and that's well-being. We're going to be talking about well-being as a strategic priority in police reform. What works? What doesn't work? What could be done better? Well, I've got a fantastic panel here who are going to help us talk through all of those things. We have Ian Cook from Blue Light Services, who followed his 18 years as a police officer with a role supporting health and well-being of 4,500 police officers all around the country. We've got Professor John Harrison, he's the National Police Chief Medical Officer for England and Wales, the College of Policing. And, well, again, a lady who doesn't really need much more introduction because we've already seen her featured, Kerry McMahon-White from Police Mutual, our sponsors. We all met you yesterday, but what we're going to be doing in this session is really exploring where well-being fits into police reform. We've had a little hint of it from some of the previous sessions this afternoon, but we want to look at a focus on how forces can move on from reactive support to the preventative, more proactive approach that has been embedded in all of your leadership strategy. Okay, so Professor, let's start with you and talk about, because well-being, it can cover so many things. We were just talking about it before. What is well-being in this context?
Yeah, I think it's, sadly, it's a rather nebulous concept for at least some people. And that's to its detriment, because I think people, because of that, and you can't sort of nail your colours to the mast on it, that people potentially disregard it. But I think the Office of National Statistics did a really good job. They looked at a whole load of parameters that could affect people's well-being, and they actually boiled it down to 4. So it was how happy are you feeling? Is life meaningful? Your sense of purpose and an absence of mental ill health, anxiety or depression. Well-being is really important because it correlates very, very well with engagement. And I think for forces, that's really important. And if any of you have seen the results of the recent annual survey, I think some of it was shared earlier, you will see we've got a real job to do here.
I was going to bring that up. I mean, Kerry, you used some of those facts and figures when you spoke yesterday. We've seen them in some of the presentations today. It's a pretty gloomy outlook. There's been a real knock to morale. What would you say the root cause of that is? Is it that every force is doing something different?
Yeah, I think when you look at policing as a whole, I touched on it yesterday, the way policing has evolved over time and how people deal with their circumstances has changed as well. So many years ago, police officers would be out doing their job, they would have time to debrief with each other, they would, chat in the canteen, they would spend time, but, things evolve and change, canteens have gone, spending time with each other, so there's got to be other ways to help and support people with their well-being overall. And I think it's about how does each force manage that and support it, because each force is operated differently with a different chief. And it's how do me as an organisation support the forces to be able to deliver well-being outcomes.
Different forces, different chiefs, communities that are made up of different ways. We're talking about it a little bit in the abstract, but Ian, you've worked with officers on a one-to-one and a group basis. What stories are you hearing?
Sadly, the issue becomes is because it is completely different right across the country. Depending on where you are in the country will very much determine what kind of well-being and support you get. We've got officers that will speak highly of forces, and then we've got officers that have been let down. And the one thing that we can't get away from is that there's 18,000 police officers currently off sick with mental health and PTSD. That is the same as some of the forces that are being represented here now. And as police forces right across the country, we've got to accept that that's not acceptable. And more needs to be done. And there's a massive disconnect with ranks. Everybody is sadly scared to or not willing to talk about what's really happening. We've got ranks that are not willing to go and speak to the rank above because they're worried about what the detriment that potentially may well have on them. We've got PCs and sergeants that don't feel listened to. And I can safely say that because I've spoken to 4,500 of them. And it's right across the country, we've got PC sergeants and inspectors who feel like their voice isn't being heard. And the biggest thing that can change in this country for policing is relatability. We need to have better conversations and change police culture from what it is now, of being an organisation whereby by putting your hand up and asking for support or asking for change is seen as a problem. We've got too many police officers and too many staff members that when they are putting their hand up, they are not being listened to. It's like having a Lamborghini, and this is the best way I can put it, so stay with me.
I don't know how many people in here have got a Lamborghini.
Well, I certainly haven't, but it's like having a Lamborghini and it's in a garage and no one knows about it. It's no point in having it, and you don't drive it. And that's the same with wellbeing. You can have the best wellbeing in the world, and I can guarantee some forces here have got amazing systems in place that offer really good support. But when you've lost the trust of the officers and staff, which has happened, they're not willing to put their hand up. We've got AFOs, we've got people on roads policing. That was the department I was on. I had the pleasure of working on one of the best departments in policing, in my opinion. And I know police officers that were not willing to put their hand up because they were worried about the consequences. That can't happen. And sadly, the people in this room are in a position whereby that change can happen. But it needs to start with real conversations, and it needs to start with police culture being changed. Because there's too many people aren't willing to put their head above the parapet because we're worried about what's going to happen.
Professor John, if you, in terms of your work as the police chief medical officer, can you chime in with this? Or do you think that there is support, there is stuff there that people just don't know about? Or do you think it's then the wrong support if it's not being taken up?
I think there's a whole host of things. I think in terms of the Lamborghini, from a policing perspective, the National Police Wellbeing Service has been in place now since 2019, and we have produced a vast array of resources, training, films, we've had videos and so on. And the big frustration for us, and it goes back to what we were hearing earlier about the 43 different police forces, is you can take a horse to water, but you can't necessarily make it drink. And it's how do we engage sufficiently well, A, with forces, and as I speak today, we've engaged very well with some forces, and I'm not going to name them, but there are some forces who are doing some fantastic work. Similarly, there are forces who don't engage with us whatsoever.
I think you should name them.
Well, no, I'm not going to, but I'm happy to name the ones that are doing really well.
Okay.
For example, last week I was just sharing with you, I gave a talk to the COG SLT Day in Wiltshire Force, and they are doing fantastic work. Everybody is buying in at the senior leadership level. They have developed their own health and wellbeing strategy based on our national health and wellbeing strategy, and they have got some practical plans as to how they're going to implement it. Now, having said that, they will be the first to accept that across their force, there'll be people in the force who know nothing about what they're doing in wellbeing. And that's another major challenge I think, for any police force, is how do you get to the front line? And going back to our annual survey, 9% of people on the front line felt that their senior officers would listen to them and take action to sort out the health and wellbeing problems. So that is an absolute crime, isn't it? So it's a massive challenge, and I come across a lot of cynicism in terms of health and wellbeing, because you say you're doing things at the top, but people are not seeing it at the bottom.
This comes back to what we've been talking about over the last couple of days about things being more joined up and more transparent. Yeah. Quite a few questions coming in. Do keep them coming. And of course, if you want to jump the queue, put your hand up and I'll make sure a microphone gets to you in the audience. Anyone? Anyone? Oh, we've got one at the back. While the microphone's going there, let me just ask Ian a question that's already come up here for you. So what do you feel is one of the biggest drivers for disconnection and in some cases frustration between officers and staff on the ground and colleagues in senior leadership ranks?
Well, I'd probably say the biggest thing is the fact that PCs and sergeants may well have certain questions that they never get an opportunity to ask. Like, for example, there might be something, for example, response officers right across the country are burnt out, struggling. But how many superintendents are really going out there and sitting down and speaking? There'll be people in this room that do that, by the way. I'm not going to label everybody because that's never my intention. But are we sitting down and actually giving these PCs and sergeants and the inspectors the time that they deserve in an environment where they can speak? And I'll say, right across the country, it's not happening. I talk to response officers every single day. Inside our programme, we've had 700 over the past 3 years. And not one of them says that that's happening. For me, one of the biggest things about the way to improve health and wellbeing and stop the disconnect is creating PC and sergeant forums in every department, right across your forces, and have monthly meetings with whether it's superintendents or exec team members, and have it a safe environment whereby you can turn around and say, what are the real issues? You will get then the PCs and sergeants opening up, and what it will allow you then to do as leaders is to say, we take that on board, but here are the reasons of why we can't do that. And at the minute, that's where the disconnect is. Because I've got no doubts every person in this room wants health and wellbeing to be better. And if you didn't, then you probably wouldn't be very good leaders. But I can guarantee you all do. But for me, if you have got staff that haven't got the answers and they're not willing to ask the questions, they haven't got a platform to ask the questions, how can we ever make change? Relatability and safety for the officers is absolutely key. Safety to ask questions and not feel like they're the problem. And for too long in police culture, did 18 years, I was never wanted to get promoted, but I did it in West Midlands Police, and I'll tell you now that you feel like you're the problem when you bring something up, and that should never be the case.
I can see you want just quickly, because I do want to go to that question.
While Ian was talking, an example popped into my head, and this goes back to when I was Chief Medical Officer for Devon and Cornwall Police. One of the superintendents, chief superintendents there, Julie Fielding, was a commander for Cornwall, and she carried out a survey of her patch, her BCU, and then went through a process of feeding back the information. So I think what I liked about it was, one, you're actually asking people how are they feeling and what are the challenges, what are the issues for them. It was then fed back, and not surprisingly, you will find that a lot of the problems were what we call the hindrance factors, the things that get in the way of doing your job. And I joined her, and we went round various police stations feeding back the information, but also then saying, this is what we're going to do about it. And she basically grasped the nettle and sorted out a lot of the hindrance problems. Yeah. And obviously, she couldn't solve everything, but she sorted a lot out. And I think that went a long way to making a difference.
Would you like to ask the question? Person who was...
That was the one Ian answered.
Pardon? Oh, it was...
Ian's answered it.
He's already answered it already. Okay. Anybody else from the floor while the microphone's roaming? It's fine. We've got plenty of other questions here. I mean, did you want to chime in?
Yeah, it's interesting listening to the conversations that the problem that's, you know, I guess the challenge that we have around the communication and the culture, it's not just in policing, so it's not just a policing problem. If you think about large organisations, the NHS, teaching, to disseminate the right culture, exactly the same problem. Leaders and chiefs of any sort of public sector, if they want to get information down, it has to come through the key leaders throughout the business to then land. And I think the conversations we're having is around that disconnect. So there isn't going to be a one solution that's going to solve the problem. It's how the different forces, the different ranks can come together on how this is disseminated down to the workforce.
So, I mean, John, do you think there should be minimum standards as well for support to be mandated, maybe, across forces and inspected?
Yeah, I mean, the problem is the mandation, because going back to 43 sovereign police forces, it's very difficult to mandate. Now, we have been working with HMIC FRS around the field inspections, and they do ask about well-being, but it's still in its infancy, and it goes back, I think, to this nebulous idea of what do we mean by well-being. And I think some of the inspectors have struggled. You know, these are not well-being practitioners, these are essentially retired policemen. I think a way forward for us is with the advent of our new National Health and Wellbeing Strategy, which is a life cycle model. It's got 5 delivery areas: join well, train well, work well, live well, leave well. And we've got some delivery, some priority, national priorities for those delivery areas. We now have a framework against which inspection can take place. So hopefully we can improve on that. And then what we do know is when the HMIC-FRS report back, chief constables do take note if they don't do well.
Ian, this one's for you. So if you were to be hired as a wellbeing advisor to superintendents right now, what would be the top 3 pieces of advice?
Well, the first one would probably be to actually go out. One of the biggest things that I get told from officers is that they don't see the superintendents, they don't see people enough. And that immediately creates that gap, even when you don't feel it's there. And if you were to kind of go out and experience what the officers are experiencing, not to say you haven't been there, because you've all been there, you probably do know what's going on, but policing changes. And for you to be in a position whereby you can understand what the challenges are, I think that's really big. The other thing I'd do is I'd do the forums. I genuinely believe that again would create a massive. I think it would help massively in relation to stopping the disconnect. One of the biggest things is the fact that people don't feel comfortable enough to come and speak to you. There are probably forces in here that do ask the boss. We had one in West Mids, and it was a little like post box, and you'd post it in, and you'd never hear anything. So it was a completely pointless exercise. And on some occasions, the business manager was answering the questions. Now, what that immediately sends the message out is, well, the superintendent's far too busy to answer these questions. And in my opinion, that's just not acceptable. For me, it should be that we sit down every single month and we understand the challenges that the officers are facing. And it gives you an opportunity then to tell the officers why you can't do certain things. And then I think the final one, in my opinion, is to invest in helping your sergeants. Sergeants are the key for this, because we haven't got 18,000 police officers off sick because it's all going well. It's because that people don't know how to signpost people. Just like we were discussing earlier, we've got a national wellbeing programme now. But if you ask your sergeants how they signpost people, I can guarantee they don't know how to do it, because they don't know how to do it in West Mids. And the reason why I can safely say that is because I've spoken to the head of HR, who told me that direct. They are the key. So if you're a superintendent of a department, I believe that your main priority is making sure that you're able to get and look after the staff in your control. And the best way for you to do that is to have your sergeants fully aware of how they can signpost people. They're the people that are going to be out there every day. They're the people that have got pressure from above, they've got pressure from below, and they need to have the confidence to know that they can signpost people correctly. So those are the 3 things, and it all comes down to communication and having an ability to stop the disconnect. The moment you do that, I think you win.
A big part of what you're talking about is increasing, face time, isn't it?
Yeah.
And communication. But we all know time is money. Now, you were talking yesterday, Kerry, about how Police Mutual Invest puts money back into the forces. Can you earmark it particularly for these kind of projects and initiatives?
Yeah, I mean, at the moment, we have... I'll deal with it.
I think it's mine. I don't know.
Is it yours?
Someone's is dodgy.
Sorry. Yeah, I think, as I mentioned yesterday, there are lots of support services within policing. It's not just Police Mutual. There are lots of other wellbeing forums. You've got Andy Rhodes, who's not with us today, but running Oscar Kilo. We work very closely with all wellbeing partnerships across the force. What we don't want to do is, it's not to replace them, it's to complement. So whatever initiatives people have within a force or nationally, we want to help and support and complement. So I think it's understanding what is it each force, or from a national perspective, is the aim, and then all the other support services along with us will be able to help. Because at the moment what we're doing is talking to forces and saying, right, we can give you a care line, we can, which is like an EAP service, which most forces have. So is that the best way of us giving back? Is there another way that we can help and support? And I think it's understanding what forces want the outcomes to be. And like Ian said, most forces are doing a brilliant job, but it's working together. I think working together and having that real focus on the end result, really, and rather than just saying we are delivering well-being, but what does that mean for each force?
Here's one I think maybe all of you could have a point of view on. Who should fund force welfare provision? Should NPCC budgets be top sliced to allow a national arrangement? Do you want to take that one first?
I mean, fundamentally, the responsibility for well-being and the same as health and safety rests with the organisation. So I don't think you can abdicate responsibility. I mean, clearly there are funding issues, and so I think we're moving towards, and again, it's again with the backdrop of reform. I think we're moving towards a different framework of support, and I do think the national centre has a role to play, and it may well be, if we see the advent of the National Centre for Policing, that we get new funding avenues set up to support certain things. I mean, clearly Oscar Kilo is a national resource that's not funded by the police. So I think it's probably going to be a hybrid setup, but I think there is certainly the opportunity to do things differently.
What do you think, Kerry?
Yeah, it's actually interesting. So if you think, I mean, Ian, you mentioned about police officers that are off sick at the moment. So if you think how much that is costing each force, what could be done differently to save the money? So actually by putting in some preventative measures, they may not have the bill of the staffing challenge if the preventative measures were put in place. Now, you know, I'm not in a position to talk about that, but I guess it's an observation, yeah. And actually, I think it just needs working through. And there's some chief officers and SLTs that have been very brave in forces and are looking at that. But again, there's a lot of pressure. There's a lot of pressure in running forces and running those type of operations.
Ian, sergeants tell us they are bogged down with admin. They get stuck to their desk. So what does your feedback tell you about unnecessarily burdensome tasks that they could or should be getting them to stop so that they can be free to lead and do the things you're saying that are potentially lacking?
Well, I was never a sergeant, but I know that being a sergeant is probably the most challenging role in policing, because you're inevitably looking after quite a large number of people and you've got a lot of pressure from above. I mean, obviously every force is going to be different, and it depends what department you're on as well. Some departments are going to have more time, some departments are going to be more bogged down. For example, if you're a response sergeant, looking after the welfare, the wellbeing, dealing with the incidents that are coming in, having to sort out staff welfare, I can imagine it's really challenging. But that has to come from, again, that question could be solved without money. It can be solved by having a conversation with the sergeant and asking the sergeant, what do we need to do to free your time up? Instead of saying to the sergeant, well, the sergeants are telling us, well, let's ask the question, why then? What could, like for example, one of the things that right across the country, response teams carry workloads. I think that is absolutely ridiculous. I was a response police officer for 10 years, and I spent 4 years. I didn't carry a workload. Morale was through the roof. We went out, we were able to do our job effectively. And then we changed the model when a new chief constable came in. And we then had workloads, and people looked to leave immediately because you can't be an effective response police officer and deal with the actual demand that's coming in when you can't get leave. You feel like you have got a massive disconnect. It's the only place in policing that you have to apply for, response policing. That says everything about what we think of response police officers, and it should be the most important role in policing. But they're bogged down, and they don't need workloads. They need to be freed up to go out there and serve the public in the right way. Merseyside are one of the only forces in this country that don't carry workloads. I don't know, but I can guarantee with the new chief constable coming in that it probably will change very shortly, and they will carry workloads. And I'll tell you from knowing and speaking to hundreds of police officers from Merseyside that will completely change the demographic of response policing there. Response police officers will leave. I can tell you on West Mids, 2-year service, off they go. They want to go to... I was on traffic for 7 years. I don't know who's been on a specialist department, but in my opinion, you earn your stripes a little bit and you kind of get a bit of experience. Not through no fault of the officers, by the way, but after 2 years, they were applying for traffic and getting on. And it wasn't because they wanted to be traffic officers or on roads policing, it's because they wanted to get off the response teams because their workloads were too high and they wanted to get away from it. And in my opinion, that needs to change. Sorry, I've rabbited on. I will rabble, so I do apologise.
Well, you do paint a very gloomy picture. And of course, this is about pointing out some of the challenges and the things that do need to be addressed. But I wonder if you can describe any best practices that you've come across. And you mentioned Merseyside, you fear that's going to change. I'm not sure after what we heard from Rob Carden earlier on in the day. But maybe you've got some examples there and maybe you do too.
Well, I mean, the thing for me initially, like I say, would be to make it doesn't matter where you are in the country. And I know the argument will be, well, who's going to look after the investigations? I know that's the first thing any leader quite rightly would say. But when you've got a force that is performing really well with their response teams and their morale's through the roof, why on earth would we change it? And why on earth, when we can see right across the country that response teams are absolutely on their knees, why aren't we looking at it and saying, you know what, that really does need to change? But I think sadly with policing, we don't like the mirror being held up against us sometimes. And that's got to change because we need to listen to the officers and we need to look at the numbers and taking the workloads off those officers can free up and we can give a better service to the public. I think giving the response officers a voice is another big thing. And I know we keep talking about it, but it really is so important. And we talked about budgets earlier and who needs to look after them. Nobody. Because you've got your budgets, you know what you've got to work with, and they're probably going to be cut. All the things that I'm asking you to do and all the things that the officers are asking you to do are free. You don't need to reinvent the wheel. You just need to be relatable.
Well, John's been talking about the workshops and the videos and the education piece that you've been doing to support people, the resources that people have got. Where do you see that there's a good practice in place?
There's a national problem facing policing, and that is around the demand and the rising demand, inexorable rising demand and expectations of the public set against whatever resources are given. And I don't envy the task of people in this room trying to sort that out. But I think we can start to look at how we do things differently, and as much as possible, that should be evidence-based. So I think there needs to be more research, and it was interesting to listen to who was it? Caroline, wasn't it, from the Office of the Chief Scientific Advisor. So it's really good to hear that there's more investment in the research and looking at the best way of doing things. I mean, one example, we've been focusing on response officers, and I think we shouldn't forget all the other branches of policing who are under the cosh as well. But again, an example from Devon and Cornwall, we were very keen to building wellbeing sessions for our police officers and police staff. And in some roles, it was a lot easier than others. Response, it was very difficult. But looking creatively at the rota, it was possible over a period of time to build in wellbeing sessions. So that's just one example. It didn't cost anything. But I think prevention is massively important. I think the culture of the force is massively important. Our National Health and Wellbeing Strategy is essentially, we're going to use the word again, operationalising the Blue Light Wellbeing Framework. Now, those domains give you lots of information about what good looks like in terms of the culture, prevention, managing people's mental health, managing attendance as well. So that health and wellbeing strategy is the opportunity, I think, to say, well, how can we do things better? Linked to the strategy, we have the workforce prioritisation guidance, and that will signpost you to the massive resources that we've created through Oscar Kilo. So what I would ask you to do is to do your own needs analysis locally, find out what it is, where it is you need to intervene, and then look at what resources are available to you that will help you with your annual delivery plan.
Okay. Kerry, do you want to add to that in terms of hearing the stories, seeing what's available, hearing stories about funds being squeezed? What do you take from that? What would you think, well, I'm going to apply that to what we do, which could in itself help?
Yeah, I think, listen, actually, that I think it starts from the very beginning, doesn't it, when a new recruit or a new joiner starts, and the programmes that new recruits have are phenomenal, actually. There is lots of information, lots of things about the role, lots of things about well-being, but if you think how long that course is, and then they're going to do the job. So I think it's that follow-up. So like I know everybody shares the same in this room. It's about having the right tools in place, but individuals knowing where to find those tools. But the follow-up element, like Ian said, is just about talking about them. It's that repetition, isn't it? Everybody's got really busy jobs, lots of stresses. And we've been talking about well-being, but well-being isn't just a title. There's lots of elements that's part of that well-being. It's the physical, it's the mental, it's financial. It's not just, they've got poor well-being. It's what's actually the root cause of that. And I think that's part of the conversation.
You both want to go in, so let me just bring Ian in here, because this also chimes in with one of the questions that's come through that says, do you think some of these wellbeing issues, which would cover all of the things that you mentioned, Kerry, are to do with how the job's being sold to new officers, maybe not being realistic from the off, and maybe we're recruiting people who don't have that much resilience due to a lack of experience, which taps into what you're saying about getting it all right initially, but then not being the follow-up.
I think so. I had a message from a new officer just yesterday who said, I didn't join to be behind a desk. And he was a response officer. And I responded and I said, well, sadly you did. And that's kind of comes down to the fact that I think a lot of people are joining with the kind of idea that it's job to job to job to job, and it's not. It's actually a lot of your time is taken up doing things that maybe you hadn't considered. And when we've got recruitment campaigns whereby we are talking to A-level students, for example, now there's nothing wrong with that at all, but when you put a recruitment campaign and it's specifically talking to an A-level student that's just got the results, and then we're encouraging those people to apply, I'll tell you now, I joined at 21 and I had no idea what I was doing, and I still didn't at the age of 39 when I left, but I don't think it's the right thing to do. And when they're coming in, we've had people that have said, I didn't realise I had to do nights. I didn't realise that I was going to deal with violence. There's no role like policing, and we need to do better at highlighting the challenges. And I think forces, sadly, and especially like with recruitment, we're afraid to tell people the truth. And that's actually to a detriment to policing in general, because what we forget is the retention levels are at an all-time low, and people are leaving at record numbers. And that's not because they can't be good police officers. It's because they feel let down or they haven't had the proper information. And the question that you asked me earlier was around a force that was doing well. And I think it's really important to highlight the good as well. And Humberside, Gary Foster, who is a superintendent in Humberside. Now I've been really impressed with what they are willing to do. And it's not because they're using me, by the way, because there's much better people on this panel than me, by the way, but he invited me to do a wellbeing webinar for Humberside, which it was an absolute pleasure to do. And afterwards, the feedback was that it was really enjoyable and we were able to really deep dive and have a safe space. I'm not suggesting for a second that I want 43 forces to contact me and say, will you do? I will, if you want me to, but for me...
Is that a dare?
Yeah, well, we'd see, but for me, what it means is that for a lot of police officers, that they want to have a voice, and I think if we can do wellbeing days a lot better than what we do. A standard wellbeing day in policing is a wellbeing dog, who were lovely, by the way, some pens, and a couple of stalls. That's what a wellbeing day is. And in my opinion, a wellbeing day could be, you know what, we're going to do a force-wide webinar and we're going to talk about the issues and get experts in from various different areas and actually deliver some real value, record it and put it on our intranet. And then as a force, what you can say is, well, we're trying to deliver as much as we possibly can. At the minute, we haven't got officers that want to speak out. And what we found from Humberside was that they had a bigger attendance than they've ever had before.
On a webinar?
And a webinar.
Okay.
In terms of when they normally do webinars, the numbers were lower. And when we did our webinar, they put it out and we were able to reach more people. And for me, you know, that's something really simple. It doesn't cost any money. And when we're talking about budgets and policing is going through, you know, some real issues, that's free. And I'm sure people who are passionate in the area would love to do it for free. But again, we've got to be willing to put ourselves out there and do it.
Go ahead.
Yeah, I think we are making progress. I joined Devon Cornwall Police in 2014, and I remember having a conversation with the Chief Constable a few months into that, and saying, for me, it was a bit like going back in time. I mean, I'd spent 20 years in the National Health Service. It was a bit like going back in time in terms of talking about mental health, and there was a real stigma. Over time, and it's not perfect, but we have, certainly in Devon and Cornwall, we changed that, and that was through getting people to have conversations. It was through getting certainly senior people to shoot little videos to talk about their own experiences and how they'd overcome those experiences. And obviously these were people at a very high level in the force, so the fact that they'd had some kind of mental health problem had not been held against them. So I think things are improving. But we still got work to be done. I think now, so I said back in 2014, it was like going back probably 5 or 10 years compared to my experience in the National Health Service. I think now we've probably caught up at least 5 years, and we're probably somewhere between the 5 and 10. I don't think we've quite got there in terms of maybe the conversations that are had in the National Health Service. But I do think we're winning, and I think this group here can make a massive difference, because you are essentially the business leaders. I know you're not quite at the top of the organisation, but you are the business leaders. And you as commanders make a big difference in terms of your command unit and the culture and the processes and the conversations that take place.
I think somebody earlier called you the engine room of policing, which some stuff. I want to zone in on something you mentioned earlier about how this is, we're talking quite a lot about mental well-being and physical well-being, but that financial well-being being so crucial too. What more would you like to see being done in that aspect?
Well, actually, it's we work with Oscar Kilo quite closely, and the College of Policing. And when financial education is now part of the College of Policing as part of inductions for new recruits, because financial awareness and understanding is critical. You know, my daughter, I was saying to Ian earlier that my daughter's 19, she's just finished her A-levels, she's actually applied for West Mercia degree. Programme in policing. She was at her interview on Monday, so cross fingers. But, you know, I have given her the warts and all about policing and what it entails, and she is still gung-ho on joining. You know, that's what she really wants to do. It's a passion. But Millie hasn't had any financial budget planning. She knows nothing about, I mean, I've drilled it into her now, but they don't learn it at school. So as Ian and John have mentioned, you've got these new recruits joining a police force, probably getting a car on finance. We have a financial resilience tool that we have available, and all forces have got access to it through our relationship managers. But that gives us an understanding of what the financial understanding is within each force. And over 33,000 police personnel have less than £125 a month of free income. And, you know, that is concerning. So it's about understanding, and that puts a strain then on people's mental health. It puts a strain on family. And I think it's just having that understanding from the very beginning and following it up. And there are many forces that are very supportive and absolutely understand it. But again, it's that follow-up, isn't it? And I love the ideas that we've talked about. There are a lot of forces that do webinars. You know, we do a hell of a lot of webinars. Partners do a lot of webinars. Other companies, the other financial services businesses do a lot of webinars. But again, doing a webinar is good, but it is the follow-up.
But a lot of the resources that were available because of budget cuts and because of reforms aren't there anymore. I was talking to someone yesterday who remembered going on a job in Bethnal Green in the east end of London, and the officer in charge lived in Ipswich, which I don't know how everyone's geography is, but that's absolutely miles away. I haven't got a police background, but I live in a flat which used to be a building that belonged to the Met Police. It all got sold off. Those subsidised housing and all of those things don't exist anymore. So what could be done? What resources are there to help with people's financial resilience and well-being?
Yeah, I mean, there are lots of organisations out there, but I think it's more of the understanding of budgeting and understanding what it actually means. We were talking about new recruits coming in, but also you've got people that are coming into policing as a second career, that are a more mature individual. You know, some of these people are taking pay cuts to join the police, and it's what does that actually mean from a budgeting perspective? And I think it's just having the tools available from each force to be able to support it. There are lots of free tools available, and I guess it's just pooling that resource, from a force to work through it.
John, let's come back to some of the questions that keep coming through from you guys. Thank you very much. Keep them coming. Is there evidence to show embedded force-owned psychologists, physios, and OH professionals, occupational health professionals, improve well-being more than outsourced providers?
I don't know of that evidence. I think the key thing is first of all, to go back to the prevention thing, try to set up work in a way that it's not going to cause health problems. Now, we know, obviously, in policing, we can't remove risk altogether, so it's about what can we do to mitigate. So I think the second thing is about early detection, and that can be hard because, as I think we said already, people are not always prepared to hold their hands up, and obviously men are the worst examples of that. So early detection, and we run a health surveillance programme that is funded centrally, that forces can take up, not all do. But having detected someone who is struggling, it's then what do you do? And I think it's a combination of making sure that you've got a good occupational health service who can look at the work-related factors, but then also you've got timely access to the appropriately trained therapists, and often in policing, that there will be a trauma component to that. The NHS sadly often lets us down in terms of timely access to the appropriate therapist. So in Devon and Cornwall, we actually set up our own external network, but I'm also aware of forces who've got an internal embedded psychotherapist as well. So for me, I can't distinguish between the two. I think the key thing is the timely access to the appropriate specialism.
Ian, what is a well workforce? Is it having time and space to do a good job, no matter what department you work in? Will wellbeing be a positive byproduct of effective police reform, or are we overcomplicating it all?
I don't think we're overcomplicating it. I think what well-being will look different to every person in this room. You know, I would argue that there's probably a case to have operational well-being. We were talking earlier about new recruits coming in, and the moment that you leave your training environment, when was the last time anyone in this room had any support in relation to their nutrition, their sleep, their energy? I can guarantee, at a show of hands, that how many people in your careers, since you left training, have you had any nutritional support, sleep support, any sort of guidance on anything relating to your lifestyles as being a police officer?
Or show of hands. Anyone? Oh, a couple.
It's all on the Oscar Keeler website.
Yeah.
Not from the force, I mean.
No, but
Yeah.
it's accessible. It's all there.
So,
But it's the signposting we're talking about.
yeah. So, my point being there is that out of this room, a quarter, maybe.
I'd say you could count it on one hand, the number of people.
Okay,
with their
I've
hands
probably
up.
been a bit generous. But,
You need your varifocals.
yeah, probably. But my
Did you
point...
get your free health check? from
I should have gone through my
registration?
force, shouldn't I?
Time's ticking.
But my point being is that for a lot of police officers, it stops after you do your 18 or your 20 weeks. And then it's either sink or swim. And I totally understand that there is an element of personal responsibility. Of course there is, because we're adults, and there has to be. But there is also a little bit of an element on the job, in my opinion, to say, you know what, we're here to offer a little bit of support on how you can eat around the shifts, how you can improve your sleep, your energy. Because if you can focus on those things, I'll tell you from our programme, the moment that you do that, people feel better. And at the minute, I don't know whether that's available in any force. It may well be an Oscar Kilo, and I've got no doubts that it is. However, if you were to ask the majority of PC sergeants, do they use Oscar Kilo, that might be a different story, and that's where I think we need to have that relatability, because at the minute, I don't think police officers trust it. I don't think police officers are putting their hand up because they don't trust what's going to happen. Like I said earlier, we've got police officers that are not willing to put their hand up because they're worried about being moved, or they're worried about what the stigma is going to be. There were people in this room, as hard as this might be to hear, there's people in this room that are not going to put their hand up and say, I need help. And it might be down to the fact that you might have a stigma attached to you, but in my opinion, it's the most biggest and best thing you could ever do. Put your hand up and ask for a little bit of support, but policing doesn't support it. And the evidence is there to suggest it. No one can sit here and tell me that they do, because I speak to hundreds of police officers every day who tell me otherwise. And they don't want to put their hand up because they're worried. And when you've got that, like I said earlier, you can have the best. It could be the best. And I'm sure, and like we've agreed, it is really good. I'm not sitting here saying that it isn't good, because it is. But nobody knows about it and no one trusts it.
Not enough people do.
Well, the reason why I can safely say that is because we were talking about financial well-being earlier, and we've got people that have got £120 and they're spending their own money going to their own therapists, because they don't want to go to the job therapist because they're worried about it getting back. Now, that's a huge problem.
And we have got a panel discussion tomorrow, which is going to dig into financial resilience and a lot of the opportunities available to you. You wanted to
Yeah,
dive
I'll
in
just
there,
say one of the services that we offer is the Oscar Kilo vans, and they are widely taken up by, I think, all forces. And the idea of the vans is that you actually you take it to a local police station or somewhere appropriate, so you can actually reach out to the front line, and you can run wellbeing sessions, which you do, but it's run by the local people who hopefully are trusted. I mean, I accept that there's always an element of mistrust. But it would be run by a combination of the occupational health team and the wellbeing teams and others.
And partners, there's partners that go out, isn't there?
And partners as well.
Yeah.
So looking at physical aspects of physical wellbeing, you can do your cardiovascular health checks. Obviously, looking at the psychological well-being, obviously you could introduce financial well-being as well. But the point I'm making is it's something that can get you out there. And also, we can flag up some of the campaigns we've run. So, it's okay not to be okay is one of them. Just ask twice. That's about getting to know your people. Are you all right? Yeah, I'm okay. No, really, how are you feeling? Just ask twice is a much better way of starting to engage in a conversation. But ultimately, it's about know your people.
Yeah, and there's a focus through Oscar Kilo on fatigue, isn't there?
There is.
It's a big programme at the moment, and you talking about response, and that there are just lots of tools out there. It's just knowing, how
I
to
just
find
wanted to
them.
give you that we're out of time, but just quickly, you mentioned partnerships there. So how important are they in making sure that wellbeing gets embedded as a strategic priority and it's working?
I just don't think it can be solved on its own.
Yeah.
There are so, and I'm not just talking from a police mutual perspective. There are so many partners out there that will help and support policing, but it's just everybody working together. That's the only way that this is gonna. There's not. The funding isn't there. So how can companies, policing work together to solve, some of the issues and challenges?
And I suppose the more everyone talks about it and is transparent, the more continuity there will be.
Absolutely.
Big thank you to our fabulous panel, Ian, Terry and John. Thank you very much.